Katherine. I'm the clinical lead nurse at Viaduct for Thames Valley Primary Care Network. So when you arrive at the surgery and you've checked in at reception or on the online screen, the nurse will then call you into the room. Bear in mind that nobody knows what you're there for, so there's no embarrassment in the waiting room. We will just shout your name. Once you come into the room, the nurse will then go through some questions with you. She'll ask about your history, any sort of concerns that we need to be aware of. She might talk about if you've got any symptoms of any abnormal bleeding or any of the red flags that we would need to know about. She will then talk you through the procedure, what happens, and perhaps show you the equipment if you'd like to see. So this is what we call a speculum. This is the part here that is inserted into your vagina, and once that's in place, we can open it and we can see your cervix, which actually looks a bit like a donut and has what we call the cervical os, which is like a little hole in the middle. We then take, this is what we call a broom, which is like a soft, flexible brush, and we turn that 360 degrees 5 times, and that collects the cells from around the cervix, and then we put that into a special pot of liquid, which takes all the cells, and that gets sent off to the lab. So the appointment, when you might see it on your online booking system, it might say for 20 minutes, and that's to give us enough time to go through everything with you, take the smear, address any questions afterwards, talk to you about the recall system. The procedure itself, though, is very, very quick, and it can be over in less than a minute. Providing we can find your cervix easily, it is honestly that quick. Sometimes we might have to get you in a different position just because every woman's anatomy is different, and cervixes can be a little bit hard to find sometimes. But once we've got it, the actual taking of the smear is extremely quick. A smear test shouldn't be painful, although it may be slightly uncomfortable for a small amount of time. If you are experiencing any pain during the procedure, please say to the nurse or the person that's taking the smear from you, and they will stop immediately. If you're a postmenopausal woman and you find that sometimes you've got symptoms of dryness which could cause pain, you can let us know about this beforehand, and there are things that you can have to treat this with to make the procedure less uncomfortable. None of the nurses or nursing team are there to judge any of our patients. We understand that it might be embarrassing and a little uncomfortable as it is an intimate procedure. However, please bear in mind that we are all trained professionals, and many of the people that you see will have experienced thousands of smear tests in their career. The most important thing for us is that you've come to the appointment. We don't care if you've got odd socks on or whether you've shaved your legs or whether you've just rushed here from work. All that matters to us is that you come and attend the screening test. Please do not be embarrassed. And if you want to discuss it first, you can do, and we will arrange to speak to you over the phone, or you can come in face to face to meet your nurse. But it's really important that you realise none of us are there to judge you. Although the HPV vaccine is a very successful programme, it is still important that you attend for your smear test. As most vaccines, none of them are 100%. However, it does reduce your risk, but it's still really important because we can also look at the health of your cervix at the same time to see if there's anything visual to the eye that might be concerning to us.